Let me tell you something that most mental health professionals don't have the courage to admit. I am a doctor. I spent years inside the system. I studied, prescribed, referred patients to therapy. And what I discovered, looking at real data, published research, and the stories of the people I treated, made me rethink everything. Traditional therapy does not work for most people. I'm not saying it's useless. I'm saying it's insufficient, and there's a huge difference between the two. According to the American Psychological Association, approximately 75% of people who try psychotherapy report some benefit. But some benefit is not a cure. And the other 25%? They don't improve. Some even get worse. More than that, a meta-analysis published in the scientific journal Epidemiology and Psychiatric Sciences directly questioned the strength of the studies supporting the effectiveness of psychotherapy, pointing out methodological biases that inflate the results. And even so, we keep sending people to the couch every week, expecting that talking about problems will solve the problems. In this video, I'm going to show you 10 reasons why therapy fails, and what science shows actually works. And pay attention to reason number 7. It's what the mental health industry least wants you to know. I'll start with a number that impressed me when I first read it. Studies compiled in meta-analyses of 146 researchers show that the average dropout rate from psychotherapy is nearly 35%. In some contexts, it exceeds 80%. That means more than 1/3 of people who start therapy quit before finishing. And the most revealing part, when researchers ask why, the most common answer is not, "It got expensive," or "I didn't have time." It is, "I didn't feel a connection with the therapist." A recent survey with nearly 7,000 people in therapy showed that 39% of those who ended the process pointed to lack of bond as the main reason. A quarter of them simply stopped showing up, without notice. This has a technical name in scientific literature, premature dropout. And it happens precisely because therapy, as it was structured, depends on a variable no one can guarantee, the chemistry between two people. When that chemistry doesn't exist, the process doesn't move forward. The person sits in a room, talking to someone who technically knows how to listen, but with whom they don't feel real safety. And safety is everything when it comes to mental health. The issue is not whether you had a bad therapist. The issue is that the model assumes any certified professional will work for any patient. And that is simply not true. Here is something counterintuitive that takes time to accept. Processing emotions verbally can, in some cases, reinforce suffering instead of dissolving it. There is a phenomenon researchers call co-rumination, when two people repeatedly circle around the same problems without movement toward change. In a study conducted by psychologist Zbigniew Wybierał from Masaryk University, which analyzed 936 reports of negative therapy experiences taken from 51 studies in different countries, one of the most frequent complaints was exactly this. "I only talk about the problems, but I don't leave with solutions." Conventional therapy, especially more traditional approaches, prioritizes insight, understanding where the problem comes from. But insight without action does not change behavior. And changing behavior is what changes life. Think about it this way. You can spend 2 years perfectly understanding why you fear intimacy, tracing the fear back to childhood, naming the pattern with clinical precision, and still be alone on Friday night. Understanding is not transformation. What neuroscience shows is that the brain changes through repetition of new experiences, not through analysis of old ones. You don't reprogram a behavior by talking about it. You reprogram it by living something different, repeatedly, until the new pattern becomes the pattern. I need to be direct here. Having one therapy session per week in many cases is like hiring a personal trainer to see you 1 hour per week and expecting to get in shape. What happens to your emotional state from one Monday to the next? No one follows it. You spend 6 days processing experiences, reacting to triggers, making decisions, and then return to an office to talk about what happened. The model assumes that 50 minutes per week are enough to modify neurological patterns that took decades to develop. Research shows that people who need significant progress often require 20 sessions or more before experiencing real change. In practical terms, nearly 5 months of weekly therapy before a measurable result. And time matters because the brain does not function in sessions. It functions in contexts. Change happens in daily life, in interactions, in moments of stress, in small decisions. And those moments are, most of the time, completely outside the reach of therapy. This is not a criticism of therapists. It is a criticism of a format that was built for the convenience of the system, not for the biology of human change. Now I'm going to talk about something that deeply bothers me as a doctor. Most studies that prove therapy works were conducted by researchers who believe in therapy. And there is a documented phenomenon called allegiance bias, where the results of psychotherapy research are significantly influenced by the theoretical affiliation of the researcher. An analysis published in Epidemiology and Psychiatric Sciences concluded that many psychotherapy studies have serious methodological flaws: inadequate randomization, lack of outcome blinding, high dropout rates that are not properly accounted for in the data. In other words, the numbers that support therapy as a first-line treatment may be inflated. That doesn't mean therapy is a fraud. It means we are making medical decisions based on weaker evidence than we think. And the patient sitting on the couch doesn't know this. They believe they are following the most scientifically grounded protocol available. And maybe they are not. As a doctor, I have an obligation to be honest about this. Transparency about the limitations of interventions does not weaken medicine. It strengthens it. It's time to talk about what actually works, and I'll start with the most underestimated of all: physical exercise. Not as a complement, as a primary intervention with an effect comparable, and in some studies, superior, to antidepressants for cases of mild to moderate depression. A review of 100 studies published over 20 years showed that physical exercise, especially high-intensity exercise, increases levels of BDNF, brain-derived neurotrophic factor, as much as antidepressants. BDNF is a protein that stimulates the growth of new neurons, strengthens existing connections, and promotes neuroplasticity in regions directly linked to mood, such as the hippocampus and the prefrontal cortex. In simple terms, when you exercise, your brain literally rebuilds itself. Neuroimaging research shows that regular exercise increases the volume of the hippocampus, a region that shrinks in people with chronic depression. And it does so without side effects, without cost per session, without the need for scheduling. What therapy takes months to try to achieve through language, exercise begins to promote at a biochemical level in a few weeks. I'm not saying to stop going to a psychologist. I'm saying, if you are not moving, you are sabotaging anything else you are trying. This chapter may seem simple, but what sleep neuroscience has revealed in the last decade completely changed how I understand mental health. Sleep deprivation and mood disorders are not separate problems. They are the same problem. Studies show that after a single night of poor sleep, the amygdala, the brain region responsible for fear and threat responses, increases its reactivity by up to 60%. That means you wake up literally more anxious, more reactive, more emotionally vulnerable before anything even happens. And worse, people with chronic insomnia have a significantly higher risk of developing depression. Not the other way around, not just correlation. Sleep deprivation precedes and causes the depressive condition. What does this have to do with therapy? Simple. You can go to therapy every week, work on your cognitive patterns, understand your traumas. But if your nervous system is operating in sleep deprivation mode, you are trying to build on quicksand. The emotional regulation that therapy tries to teach happens, largely, during sleep. It is during sleep that the brain processes emotional memories, regulates cortisol, and consolidates the day's learnings. Sleeping well is not a luxury. It is the biological prerequisite for any mental health intervention to work. Here's what no one talks about. Mental health has become an industry. And like any industry, it has an interest in keeping clients, not graduating them. I am not generalizing or saying every therapist acts in bad faith, but the system was built in a way that incentivizes continuity, not resolution. Think about it. A model that charges per session has a structural incentive for the process to last longer. A system that defines improvement as being able to talk about the problem, instead of the problem no longer exists, will always find more problems to talk about. There is a study from Time magazine that asked an uncomfortable question. The United States has the highest number of people in therapy in the world, and also one of the worst mental health crises in the world. Why? Because treating individually a problem that has structural causes, social isolation, lack of purpose, inequality, community disconnection, does not work at scale. Therapy places all responsibility on the individual. You need to heal. But often the problem is not inside you. It is in how society is structured. And while we treat each person individually on the couch, the collective problem continues to grow. Now the most underestimated antidote of all. Real human connection. Not group therapy, not sessions with a psychologist. Genuine, reciprocal, present relationships. One of the most robust findings in modern psychology is that the quality of a person's social connections is the most consistent predictor of psychological well-being across life, more than wealth, more than success, more than any clinical intervention. The Harvard study of adult development, one of the longest longitudinal studies ever conducted, followed people for more than 80 years, reached a simple and devastating conclusion. What keeps people healthy and happy is not low cholesterol or a brilliant career. It is the quality of relationships. And what does isolation do to the brain? It activates the exact same neural circuits as physical pain. Social rejection and the pain of a burn are processed by the brain in the same way. Meanwhile, research on meditation, exercise, and other interventions shows that their effects are amplified when practiced in groups, in contexts of connection. Therapy, paradoxically, is one of the few human experiences where you talk about your relationships completely alone. Psychologist James Pennebaker spent decades studying what happens when people write about their difficult emotional experiences. The result, writing about traumatic events in a structured way, reduces symptoms of anxiety and depression, strengthens the immune system, improves sleep quality, and increases subjective well-being, even when the written content is never read by anyone. But there is a crucial detail that Pennebaker's research revealed. Not every type of writing works. Writing repeatedly about the same feelings, without movement toward meaning, can temporarily worsen mood. What works is what researchers call meaning-oriented writing, where the person not only describes what they felt, but tries to understand what it meant, what they learned, how they changed. More recent research, published by Simply Psychology, confirms that gratitude journaling, writing 3 specific things you are grateful for every day, produces measurable increases in well-being that persist weeks after the practice ends. The mechanism. Writing forces cognitive reorganization. You cannot write in chaos. To put it on paper, the brain needs to structure, and structuring experience is the beginning of integration. It is what therapy tries to do, but that writing does without intermediaries, without cost, and at any time. We've reached the final point, and I want to be very clear here. I am not saying to abandon therapy. For some disorders, complex trauma, borderline psychosis, specialized intervention is irreplaceable. That is undeniable. What I am saying is that most people who suffer from anxiety, mild to moderate depression, low self-esteem, relational difficulties, are waiting for a professional to fix them, when most of the solution is in their own hands, and it is free. What science points to: move your body. Every day. It doesn't have to be a gym. It has to be consistent. The BDNF that exercise releases is the fertilizer of your brain. Sleep. Treat sleep as the most important medical intervention you can do for yourself. 7 to 9 hours. Consistent schedule. No negotiation. Connect with real people, not social media. Presence. Conversations without agenda. Shared meals. The human brain was built to coexist. Write, not to vent. To understand. To transform experience into meaning. And if you choose therapy, choose carefully. Research approaches. Change professionals if you don't feel connection. Do not stay in something that doesn't move forward because you feel guilty for leaving. Mental health is not a destination. It is a daily practice. And most of the most powerful tools for this practice have never been behind an office door. Throughout this video, you saw what the data shows and what the industry rarely admits. Therapy, as it is structured, does not work for most people, not because it is bad, but because it is insufficient on its own. What works is closer to you than you imagine: movement, sleep, connection, writing, meaning. Mental health does not begin when you schedule an appointment. It begins when you decide that your life deserves daily attention, not weekly. If this video made sense to you, comment the word evidence. I want to know who is willing to treat their own mind with the seriousness it deserves. Leave a like. It helps this message reach those who are still waiting for a solution that someone else will bring. And if you want to keep learning about mental health based on real science, without romanticism, without miracle solutions, subscribe to the channel and turn on notifications. See you in the next video.